Right.
But
Now
I'm sure looking forward to the oxygen.
right. Now my son had it as well, and that's what he said to. Now he didn't end up in the hospital. He's a little younger, I suppose.
Yeah.
He didn't end up in the hospital, but he said that the breathing part is the part that sort of hangs on.
Yes, that's what my doctor said.
Well, good morning, everyone else here this morning.
Hi, Chris.
Hi, everyone.
Hi, Chris.
Chris, tell me how I bring up my picture.
There should be at the bottom left of your screen, there should be a little video camera. Click on it.
Video camera, it says stop video. Oh, here we go. Choose virtual video settings. It says video settings, choose virtual background.
No, actually in the Zoom screen, Joyce, you should be able to see it's a little video screen. It's a little video camera and a microphone. If you're not getting a video, you probably have it stopped. Unclick that.
Well, I get that. Mute my video, start video, rename.
Push start video. Push start video.
Oh, that's okay. Don't worry about it.
We know you're here.
No one needs to see me anyway.
Hey, I need to, real quick, I had some dental surgery done yesterday, and I'm in quite a bit of discomfort, and I won't be talking much today, but I did want to make sure.
We're glad of that, Chris.
I know, but at the yeah, I'm so quiet. I'm such a quiet individual. But at the during the discussion, I really do want to discuss. We ran into an issue with the COVID patient not being able to get home from the hospital, and it was a really big problem for us. So I would really like to somehow bring that into the foreground, but might have to email you guys because conversation's not my strong suit today.
Hi all, can you see me? It's Marilyn.
Yes,
Hi, Marilyn.
Yes.
Good morning.
Yeah. Good morning, everyone.
Hi, Rosemary.
Hi there.
We'll give everybody another minute here to click in. I know some come exactly at 10 o'clock, so.
Did everyone have a great holiday? A wonderful Thanksgiving, despite having to make it pretty, low key?
Yes, I did.
Good, good.
I don't know what you're talking about. I had 50 people at my house.
Oh,
No, I'm just kidding. I am
You'd
just kidding.
You'd better be
That was a
kidding.
joke.
yeah.
I am just kidding. It was by far the smallest Thanksgiving we've ever have ever had, I think. Yeah, but I'm fortunate that I have my mom and my sister within a mile, so at least us got together. But yeah, it was the smallest dinner we've ever had, I think, probably.
Mm-hmm. For sure.
It's still good. It's still good.
Still good, for sure.
Whoops, now I disappeared.
No, you're still there.
I'm still there?
Yes, you are.
Okay.
Joyce, if you check on the right-hand side of your computer, there may be a little bit of button on the very side of it. That's where my camera is located.
Okay.
Yeah, that was a problem that you had. I forgot about that.
I had a months to months problem before we figured out why my camera wouldn't work.
Yeah. Well,
as you probably know, the camera has a little cover on it up at the top of your screen, and maybe you have to open the cover.
Hi, Mary.
Hello, how are you?
How nice to have you with us.
Thank you.
And is that you, Elaine, on the phone?
I think it's Joyce's phone. So I don't know
Oh,
if
I
Joyce
see.
No, it's not.
is somebody else who's on the phone.
685-6656.
685-6431.
Scared them away.
This is me, Monique.
Yeah.
Did you guys hear me?
Is that Monique, you said?
Yes, it is. Yes, it is.
Thank you.
Hi, everybody.
Hello.
Hi, Michelle.
I had something exciting happen on Tuesday. We were on Fox News.
Oh, congratulations.
Yeah. I'll type in the chat the link, but if you go to Fox 21 News or something, I'll look it up. And then you go under resources. They have a copy of the interview. So
Wonderful.
nice.
yeah.
Have to do that.
Could you tell me what agency that was?
Community Dental Health.
Oh, very good.
And so I was talking about our veterans, which is the support that we're receiving from you guys. So just trying to bring more attention to the vets and their dental needs. So
Nice.
Making it known that they're available.
yes.
Good for you. Proud of you.
Okay, I think we should begin this morning. So I'm going to call the meeting to order. And I guess we can see all our members here who are, well, let's have Jessica just do roll call for us.
Melissa, did you do the attendance? Did you want to run down your list?
I did. I'll run down my list. So I have B, I have Joyce. I have Kimberly from Namaste. I have Dave. I have Marilyn Massey, Marilyn Bradish. I have Wendy, Eric, Christopher, Joanne, Jen, Chris, Rosemary, Lucy. And then I have Jody and Laura as the two kind of staff. And I think I have everybody. And then I have community members that are in attendance. We have Gary from Brothers Redevelopment. He'll be our presenter and speaker. Michelle, Monique, Kathy, and then our other two family caregiver staff, Michelle Emborski and Kent Matthews. Welcome, you guys. Nice to see you. And then we also have, which Wendy and Marilyn will introduce formally in a little bit, we have a new RAC member who is appointed by El Paso County, and that is Mary. And she,
Good morning.
her little call on her screen is Chief. She could probably tell us about Chief Lady when Wendy and Marilyn introduce her later. So welcome, everyone. Did I miss anybody? All right, so B, back to you.
Thank you. Okay, so take a look at the agenda. Are there any need for change, or is it okay as printed? Okay. No comment?
Agenda sent out? Because I didn't get an agenda.
I didn't either.
This is Jody. Just a reminder, your invite has the agenda link attached to that. So when you got the Zoom link, you just scroll down and you will get a link to the entire agenda and minutes package. So that's how you would look. It does not come as a separate email.
And it's always posted on the PPACG website.
Yeah, there. Oh, there it is.
Yeah, so if you have any trouble with your system accessing that link, you can go directly to the website.
Okay, any additions or corrections to the minutes?
No.
Don't hear anything, so may I have a motion to approve the agenda and minutes?
I so move, Marilyn.
That was Marilyn Bradish.
Yes.
Is there a second?
I second Joyce Whittle.
Thank you, Joyce. Okay, there's, it's been moved and seconded to approve the agenda and minutes. All in favor, raise your hand or say aye.
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 Those opposed? Hearing none, the agenda and minutes are approved. Are there any public comments today? Jody?
Madam Chair, I did not receive any in advance.
Okay, and based in the Zoom format, we need those in advance in order to have public comments. Okay. So we're going to move on into our agenda then, our provider presentation. Gary Olsen, as the resident service manager for Brothers Redevelopment, will do his presentation.
Morning, everybody. Hope you're having a good day. I'm going to share my screen with you so that you can see my presentation. I think this is, here we go. All right. As you know, I'm with Brothers Redevelopment. I am entering my 4th year with the company, and I would say this year has been the strangest of all the years I've had the privilege of being with the company. Just to give you an idea, and I'm still trying to figure out how to work all of this, so you're going to have to bear with me a little bit. Just to give you an idea of where we are located, our office in Colorado Springs is located at 2762 Janitel, just over by the Goodwill store. And our main office is 2250 Eaton Street in Edgewater. And I've given you some contact telephone numbers just in case you need to get a hold of our company. If you do need to get a hold of me, my email address is Gary, G-A-R-Y, at brothersredevelopment.org. One of the things that we do provide is aging in place service coordination. We help people with benefits and resource navigation, application assistance, housing referrals, agency referrals, and just do a variety of things along that line. We provide as much information and assistance to people as necessary. We also, typically we work with people that are 60 and over, but I would say that periodically we wind up working with people that are just about in any age group that are looking for assistance in one way or another. We also run what is a statewide call center, and that is called Colorado Housing Connects, and you see the number there. Again, through Colorado Housing Connects, we offer benefit and resource navigation. All the things that you see here are services that we provide to virtually anybody that calls. I would say we probably field anywhere from 7,000 to 8,000 calls a year, and that can vary. This year has been a monster. The normal year is 7,000 to 8,000. I think we are upwards of 10,000 to 12,000 calls this year because of the COVID-related issues that we're all we're all dealing with. In the Colorado Springs office, we are seeing that from people in the El Paso County area, whether that be El Paso or it be Teller or Park counties, we've had 760 calls that have come to Brothers Redevelopment. Approximately 270 of those calls are from people that are over 60 that are looking for either services or some kind of referral. And you can see the breakdown there. 36% are over 60 and 64% are under 60. I've broken out the reason for the calls. Affordable housing, home ownership, foreclosure, emergency housing issues, eviction prevention, rental or utility assistance, tenant and landlord issues, and then 5% just kind of falls under a whole variety of things that people may be calling and looking for some kind of assistance for. As I'm going, if you have questions, please don't hesitate to stop me and just say, you know, what about this? What does this mean? Also in the Colorado Springs office, we are seeing that our callers typically are nearly 80% female callers, which means 20% are male callers. In the demographic breakdown of how these people are, how we're finding them, we're seeing a large number of senior disabled people calling, a female head of household, a smaller percentage of veterans are calling. We've had a few homeless calls, breakdown 10% approximately Hispanic Latino, and over 91% are under the 80% AMI for the El Paso County area.
Gary, what does AMI stand for?
Area median income. It's
great. Thank you.
It's based on the state's average income for that particular area. And anybody that falls, for example, and I don't know exactly what the area median income is. Jody, you may know what that number is. It's something like, I think it's close to $70,000 is the area median income. And 80% of that would be where most of our callers are falling, the categories that they're falling into.
Gary, this is Dave. Can you hear me?
Yes.
So on the previous two slides, I mean, those two demographics, they talked about Colorado Springs, I believe. So the question is, okay, for the under 60, that larger percentage there, and also in the male-female split, are those the same as you found as Brothers does up in Denver, or is this unique to our area?
These numbers in particular are unique to the area. I would say in the Denver area, we do have a larger male that call, but I would say the split is predominantly, it's similar, but right now this split for the El Paso area is unique to what we are typically seeing. Denver, okay. We do have a larger male population that calls it.
How about up in Denver as far as the under 60 versus over 60 split?
Yes, we are seeing, just to move back to that, we are seeing, let's see. I would say that this is probably about where that is falling in the Denver area as well. That's very similar, but we do find that as far as the male-female breakdown, it normally is a larger group for female callers versus male callers, but this particular group that we were seeing in the El Paso numbers is a little more unique because usually it isn't quite so dramatic.
So Gary, last suggestion would be, as you go forward over the next years, it would be really important to figure out, okay, so what are you trying to do? What is Brothers trying to do as far as increasing the number of over 60 population that you're trying to reach? I think that's a common problem everybody faces. So just bear that in mind going forward.
Right.
Gary, I have one addition I'd like to just bring up. There was a question in the chat by Mary, and she hasn't really been introduced yet, but she has extensive military background and herself as a military veteran. And she had a question for you. You know, what type of referrals can you help with landlords receiving rent? So that was a question she had asked, and I know she's not sure she should ask questions yet because she's not official, but I wanted to make sure that that question got looked at.
Obviously, when we are dealing with someone in veteran status or something like that, we do refer them to the VA or the veteran service officer for the counties, or if there are other agencies that are specifically working with veteran affairs or some of the issues that veterans are dealing with, we do make referrals to other agencies, but there are times when veteran status is something that we just simply deal with as well. But usually, because veteran status means veteran benefits, there are other specific agencies that work more effectively with them. All right.
Okay. Did that answer that, Mary?
Actually, no.
Okay.
Oh, okay.
Mary, you're on mute.
Mike is muted.
Okay, now can you hear me?
Yes.
All right. My question actually went back to a different slide where you said that some of what you do is for landlords.
Yes.
And I'm curious, do you have some way of helping renters who are not able to pay the rent to actually work with the landlord to make sure that the landlord doesn't then have their home repossessed because the rent isn't being paid?
Yes.
That problem actually has two sides to it.
Yes, we do. I have a slide a little bit later on, but we are a part of the statewide program that is called EHAP, which is the Emergency Housing Assistance Program within the state of Colorado. Brothers has already in the past, 7-8 months now that we've been a part of EHAP, we have distributed about $1.2 million throughout the state. We're a statewide agency working with this program. We have a website that anybody that is looking for rental assistance and that if they fall under that 80% AMI and simply make a statement that says they have been impacted by COVID, if they can make that statement and they fall under the 80% AMI level, they can receive rental or mortgage assistance. We've paid rent. Matter of fact, I'm a part of that group, that EHAP team, and I'm in the process right now of working through an application where they are requesting approximately $12,500. And that goes almost all the way back to March. So we're able to help people that have very specific needs in rent. There is a second program in Colorado that is called POP, P-O-P, and that program is specifically for landlords that have multiple tenants that are looking for rental assistance and need help to pay the rent directly to that landlord. So there are two programs that we work with. We work with EHAP, which helps the individual with their rent or their mortgage. And then we also work with and refer to the POP program, which helps landlords that have multiple tenants that are in this same situation.
Under the EHAP program, does the money that's given, does that go to the landlord or does that go to the individual to spend on whatever they want to spend it on?
No, it goes to the landlord. It is specifically designed for rental assistance, and the state has mandated that that money go directly to landlords.
Thank you.
Sure. Okay. And then we have another agency that works within our Colorado Springs office that is our housing counseling agency. We have had 93 different workshops and classes for people that are first-time home buyers. This allows them to get down payment assistance through HUD. It allows them to be able to afford to purchase a home, which is a fantastic feature. Then we also do rental counseling. We work with people along the lines of understanding how to budget and how to maybe work more closely with their landlords and different things. We deal with disputes and all kinds of other issues, and we try to help mitigate and negotiate sometimes between landlords and tenants based on things like if the apartment is in disrepair and they need to convince the landlord that it's got to be fixed. We can offer assistance in that area, and we do. We also do default and foreclosure prevention counseling, which is another separate program that is a statewide program that we offer. That particular one is being provided through HICPUF and Division of Housing. And those particular programs, HICPUF is the Colorado Policy and Finance Agency. The idea behind that program is that we're doing everything we can in the midst of this crisis to keep people from losing their homes. So the state, through HICPUF and through Division of Housing, has given us a fairly large grant to be able to help people and to negotiate terms whereby they do not lose their homes. So if it's approved, there really is little and so then we also have under our umbrella our home modification and repair department. We contract with various agencies throughout El Paso and Colorado Springs. We modify homes to allow low-income seniors to age in place. Obviously, you can read the rest of this, but probably the significant part is, once again, this is our, I think, third year of receiving $500,000 from the city of Colorado Springs and $90,000 this year from El Paso County to do these home modifications for seniors in particular. It could be seniors, but it could also be disabled. Predominantly, it is the seniors that we are working with. We've completed 69 projects. You can read, we've had over $500,000 of value that we have done, averaging about $7,600 per project. Some projects are quite a bit larger. We've even done things like put in new sewer lines for homes, and that can amount to about a $20,000 project. It's a huge thing. And then for others, it could be very, very simple. And then,
what kind of,
go ahead.
in terms of those bigger projects, what are the qualifications? Is it once again related to income? Or?
It is related to income. There is depending on the job, there is a monetary limit as to how much can actually be spent on various projects. We have to submit our proposals to the city or county for their approval before we can proceed. And once they approve it based on limits, based on the income of the household, they give us approval, and then we're able to move forward on the project. So the next one that we have is called Paint-A-Thon. And we've been doing Paint-A-Thon in Colorado Springs for approximately 2 years now. You can see the impact that COVID has had. We were expecting this year to have at least 15 to 20 projects. We were only able to complete 5. We usually have quite a lot more in volunteers that come out and actually paint the homes. But this year, we did most of the projects, we did it with our own staff because we could not get people to come out and paint homes. 2 agencies provided volunteers, but for the most part, we did it with staff time and staff hours. You can read what we have actually been able to accomplish. This is our 43rd year of doing the Paint-A-Thon, and we've had literally quite a lot of success doing it.
Great project.
Another division that we have that's working in the Pikes Peak area is called Landlords Opening Doors. And the idea behind this program is that we have a number of people that are coming back out of institutions. It could be coming out of nursing homes and looking for an apartment. It could be coming out of assisted livings or rehabs looking for an apartment. And as you know, the apartment availability is very, very limited. But it also could be those that are potentially or that have satisfied the incarceration demands in this area. And so we're looking to try and help people as much as possible in these programs. Again, this is a state-sponsored program where we are working with anybody that is able to maybe house someone. It might be a private homeowner that has a room available. It might be somebody that simply has a townhome that has a next door available or something like that. But we are constantly in touch with agencies all over the state of Colorado, and we're able to place people that are coming out of these various situations. This past year, we were able to place 62 people in El Paso County. And then this is the EHAP program that I was talking about. The Emergency Housing Assistance Program, I'm one of the managers for this program for Brothers Redevelopment. We have about 5 or 6 people that are working this program right now. And like I said, we've been able to distribute $1.2 million. We're looking at a second round of funding that we are moving into right now with CDBG funds. We are looking to distribute money probably for the next 6 weeks using those funds. And then after that, we're moving into another round of state-sponsored money that will quite literally have a lot less restriction than the CDBG funds does have. We've been able to help a large number of people in the El Paso County area, 135 people. I don't know exactly of that how many have actually received assistance. I do know that I processed a number of requests for the Pikes Peak area, but I'm anticipating that there are quite a bit more out there, and we're going to see a lot more assistance needs.
Gary, one quick question.
Sure.
With that assistance, is that a time limit on that? So is that to help establish someone to get into a new place? And is that for like a 90 days or for a 1-year period? And then do they have to reapply again? How does the timing work on that?
The regular EHAP funds that come from the state will help people that are already established in an apartment or they are already in a mortgage situation. It could also help people that are dislocated and currently living in a motel. We have helped a number of people in situations like that. The one thing this program does not do is it will not pay, for example, it will not pay for somebody's deposit on a new place to live. It cannot help them with down payments. It is only there for either mortgage or rental assistance. And the state money, the actual EHAP money, can help people and go back as far as March. The CDBG funds, they've got some wild twists on that money. And so we are only able to help people with those dollars for a 2-month period. So if somebody owes 6 or 7 months, CDBG funds can only provide them with 2 months of assistance. So we're waiting, literally, we're only going to help during the time that we only have the CDBG funds. We are only going to be helping people that have a 1 or a 2 month need, waiting for the state dollars to come back that have no time restrictions. Then we can go back and help people. We're still running into a lot of people that have 5 and 6 months that they're looking for assistance from.
Well, thank you. That was a great answer, and I appreciate that. Thank you.
Sure. All right. And then obviously the COVID impact. There are times when we will go and we will visit clients in the home. In previous years, we would go and visit clients in home, gathering documentation that is necessary to help them apply for the benefits that they need. Right now, everything is done telephonically. During this time, we've discovered there's an increased number of people needing assistance. The problem is with that increased number, that means every agency that's working with somebody, we're all crashing the same gates. And so the monies just aren't there. And if you're not first in line, sometimes you just don't get all that you're looking for. So we've discovered that we need to be on top of this as much as possible, working with people and trying to help them with their particular needs. And so that's the end of my presentation. Does anybody have any questions that I can answer?
I have a question.
Okay.
And it's not exactly about what you do, but probably some knowledge you have that I don't. There are some people in my church that are very, very afraid they're going to be evicted because they're not able to pay the rent. Can they actually be evicted by a landlord, even though the landlord is suffering and can't make the house payment? I know this is one of the situations. And so the landlord would like those people to move so they can get someone who can pay. But what are the restrictions right now on what can happen to someone who is not paying the rent?
Well, there's a couple of caveats, but one that you need to be aware of right now. The governor has declared a moratorium as of December 31. But also the CDC has done the very same thing. They have put a moratorium on anybody being evicted from their home, whether that be an apartment or any other situation like that. Now, the caveats are, for those people that are living in motels, they don't quite have the same protections. The other situation is, and we've run into some of these situations, some people get the idea that, well, then if they can't kick me out, then my behavior doesn't matter. And so the attitude is, I can do anything I want. Well, if the reason for eviction is COVID related because you can't pay your rent, you can't be evicted right now. But on the other hand, if your reason for the eviction is because of anything else, then you can be evicted, and it won't be stopped by a judge by simply saying, well, this is COVID related. So we have run into people that have, for one reason or another, they've got plenty of income, but they're just not paying their rent. And keep in mind, for this moratorium to be effective, number one, you have to be able to demonstrate that you have been impacted by COVID, and you have to sign a statement with the CDC that says, this is my situation. If you can't demonstrate that, then you're ineligible for that protection. And so, like I say, we run into people that, for whatever reason, they just stopped paying their rent thinking, well, there's a moratorium, I don't have to do it. Yeah, you do. And then with some of the people that, for example, if you're living in like a fourplex or something like that, and it is just privately owned and not owned by a management company, sometimes they can kind of get around some of that. Sometimes the issue also is whether or not a judge will actually uphold a request for eviction. And sometimes judges won't do it because they know what the situation is right now. So there's, like I say, there are some caveats. But right now we're under a protection order with the CDC and even with the governor, and we're hearing rattlings that the governor may continue to extend that protection, which simply means that they cannot be evicted for COVID-related reasons.
A moratorium.
Most important thing.
Gary, on a moratorium, does that mean that they don't have to pay the rent now, but when the moratorium is up, then they have to make up the payments that they've missed? Or are they just completely forgiven and the landlord is just stuck?
Nope, they will not, it will not be forgiven. That's why during the times, for example, if I'm not mistaken, there was a brief period of time between the governor's moratoriums. I believe it was back in July when we had about a 3 or 4 week period of time where one moratorium ended and the next one was going to pick up. But during that 3 or 4 week period of time, landlords all over Colorado were evicting people as quick as they possibly could and getting those cases to court, because they knew that if they didn't and the moratorium went back into effect, they were done. There was nothing they could do. So hopefully before the end of this current moratorium, the governor picks it back up and either reissues or gives us the latitude to help more people. We're able to help about 35 to 40 people a week, and that means we are processing applications at light speed. I mean, it's crazy.
You're doing applications, but not necessarily getting the assistance you're requesting.
Oh no, we as an agency are getting $200,000 and $300,000 advances from the state, and we are writing checks. So once they get the application to us and once it's approved, we write the check, send it to the landlord, and their situation is resolved.
And which one of those agencies is that? The EHAP?
The agency that we are, yeah, that would be the EHAP, right? But the agency that we are is located at the website that I had on the screen, BIHousingAssist.org.
Thank you so much, Gary. We've extended this time here because this is such a fundamental problem here during COVID, and I think all of us are extremely interested in your presentation and in your insight into and your access to assistance for individuals who are having difficulties. And it does sound that you are both helping the renter and the landlord through this process. I think many of us probably have not heard the landlord side of the issue before. And so that's really important information. And as you mentioned, you gave us your email in case we had further questions, and that was Gary@brothersredevelopment.org. Is that correct?
Yes. Yes.
Okay. Well, thank you so much, Gary. We really appreciate
Thank
you. Your presentation. Okay, we're going to move on then. Our Rebecca from New Vision had a family emergency and is not able to present today. So we're going to move on to membership. And of course, we have a lot going on in the membership area. So Wendy, can you tell us what's happening?
Well, that was not the right time for me to step into the kitchen to grab a different drink. So thanks, B, appreciate that. Actually, we do have a couple of different things that we need to bring up. The first thing is that we do have a new addition to our council, and I think I mentioned this maybe 2 months ago, but just as a very quick refresher course, those of us who have been interviewed or have applied, been interviewed, and then voted on and become a council member, that process is something that actually goes through the Area Agency on Aging. But because we serve 3 different county areas, we have El Paso, Park, and Teller, there are on occasion different situations where that application doesn't actually go through the AAA. It's actually someone who gets appointed through each of those different counties. Currently, we have Carol in Teller County who is serving as an appointee. And then we also have, I think Chris, if I'm mistaken, I believe Chris is the appointee that goes for Park County. But in all of my years, I do not recall us ever having somebody from El Paso County. So we were very excited when we received an application through, actually it came through El Paso County and then was forwarded to us. There was a newspaper article that I believe was in the Life After 50. And this very special lady actually picked it up, read it, thought that sounds like a good idea, completed the application and actually turned it in, yay. And so I would like to introduce to you Mary Cope. Did I say that right?
It's Kep, the always silent.
I thought it
always, yeah, the always silent, but I'm not.
Oh, so even though technically we did not need to do an interview as a membership committee because since her application came through the county and we received it, that kind of lets her slide in. However, we wanted to do our due diligence and be able to introduce her, but then also answer her questions. And so our membership committee was able to get together and spend some time by Zoom getting to know Mary. And as you can already tell, she has great questions and she has an impressive military background as a trainer, as well as having been in the reserves. I'm not exactly sure what her rank is after she's retired. But one of the things I felt that was really unique and special about her is that she serves all over the world in different locations, providing a service on missions on behalf of many people in other countries. And one of the things I thought would be wonderful is the fact that she has all these cultural backgrounds as well and knowledge. Plus, it's been a long time since we've had anybody who's had a military background, and so to have someone who can fill that role for us is really pretty exceptional. And so Marilyn and Lucy and I and Melissa also was a part of that conversation, just really enjoyed getting to know her. We do not need to vote on her, but would love for all of you to get to know her as you can. So Mary, I think officially you're in.
Okay, thank you. I appreciate that. And I'm looking forward to it. Tell them about me. Is that what you said?
Is there anything you'd like to just quickly share about yourself?
Just that I am elderly. I'm 75 years old. I don't think of myself as elderly. I think of myself as getting there. I do several different activities with classical music in Colorado Springs, though I don't even read music. And I'm active down in Fountain, where I live, and that's who I represent, I guess, as well as all of El Paso County. I've got a lot to learn, and I will try to keep my questions short, but pick up the knowledge that I need to help the people that I know who have some issues that they need an answer to. So thank you very much for welcoming me, and I look forward to being part of this committee, this agency.
Oh, well, thank you. We're so glad that you're going to be a part of things. And just to reassure you, every time we have someone new, often there are lots of more questions from that person because there's a lot more questions to be had. So that is appropriate. I don't know that I should do this next part, but as most of you know, at the end of the year, there's always some sort of a rollover and changes. And so we do have 3 significant changes. And I think I'm going to pass this to Jody just because I can.
Thanks, Wendy. Yeah. Yeah, this is, the end of the year also serves as the end of some of the terms. And as many of you know, we have 3 folks going off terms who have maximized all of the potential term usage that they can, and we sure do appreciate the roles that these folks have played. And so we have Wendy Farr is going off completely max limited within her terms. We have Dave Betzler, who has previously served as the chair before B, and now also as part of the SRS and the 4-year planning group. We sure appreciate your time, and Dave has not let any moss settle on his shoes for sure. He is at this very same moment working with one of the other committees within the PPACG structure, and has also expressed interest in potentially joining the new Pikes Peak Area Commission on Aging once we have all of that process, and I'll share more about that in my report in a little bit. So thank you, Dave. You're not disappearing, and we sure appreciate that. I know Wendy is also still very involved with some of our other groups, and so these folks are not disappearing. I'm sure you'll see them. And then Lucy Crandall as well. Lucy is headed off at the end of this year, again, term limited, and we so appreciate all the work that she's done, her insight and conversations, and participation within the membership committee. She serves, as you know, she is the local distributor, and I don't know what your title is, Lucy, but of the Seniors Blue Book, so you see that. And the interesting thing is, while that is a similar publication to our Yellow Book, there's never really been any competition there per se. We have always served as great partners, and in that respect, and so we appreciate what she has done both as a RAC member and a community partner with the Area Agency on Aging. So all of these folks have given so much in their time. They've been extremely active participants, and we love that about them. We're going to miss them adding to, but you know what? This is an open forum, so we expect you to see you all back in January, right? So
did you just get her permission to come back and talk? Really?
So we sure do appreciate every one of you and what you've contributed to the Area Agency on Aging and to seniors across our region and in your specific community. We applaud you for the time that you have given, and we appreciate you. So just a round
absolutely.
of muted applause. Thank you very much. So, and just so you all know, Melissa was hard at work, and she got certificates. So I don't know if you all have received those yet. Oh, there we go. There's Wendy's, and so yeah, and there's Lucy. We can't see yours because of the funky background, but I'm glad to see that you got those. Melissa and I had a driveway meeting a couple of weeks ago to make sure we got those to you. So thank you, Melissa, for coordinating that. I will pass it back to Madam Chair B.
Well, I think Jody, you could go right ahead to your director's report.
Well, do we have anything from Jen from SRS?
I don't believe so.
I did not. Yeah, we don't have an update currently.
Okay, thank you. So good morning, everyone. Welcome aboard. Mary, you will soon find that you're not the only one with questions. So don't sweat that at all. We sure appreciate all of you we've had quite a few new members come on just in the last few months. This fantastic move to fill some spots just as part of the transition, but also with some members who have had to step out due to some of the changes in the COVID environment. And so we sure appreciate some of our new members having joined us as well. So just kudos, a huge kudos really to the membership team, Wendy having chaired that, and Lucy and Marilyn Bradish, you know, just really great work there to make sure that we're continuing to fill our spots. So thank you very much. Just a few updates for you. As you know, we're coming to the tail end of open enrollment. That's been a real challenge this year because normally, as you, especially those of you who are used to coming in and to our building and walking through the gauntlet of public who are waiting their turn to see one of our case managers and ship counselors, we've had to do all of that. Really about 99%, and maybe even higher, but we've done that all by phone and by Zoom. And so we're still meeting the needs of our clients. We established a variety of ways to pass along information, to receive information from those clients to make sure that that we could meet their needs. We temporarily set up, and we'll actually probably keep it in place for a while just to make sure my staff has the tools that they need. But most of you are familiar with the small conference room. As you enter the lobby on the left-hand side before you go into the main conference room, we set that up in a socially distanced, appropriate setup to where if my staff has to have a face-to-face appointment, whether by needs related to technology or personal, that there's a way for my staff to meet with the public in a socially distanced manner, because those of you who may not know, and those of you who have walked the north hallway know that our offices are very small. And most of those offices, there's no way you can socially distance unless you sit outside in the hallway. So we put a lot of tools in place. They've been used. We've incorporated those into our processes. So I'm just really pleased with our staff that have worked to be flexible and figure out how to meet the needs of our clients. So really proud about that. That does end next Monday, December 7th. There were no extensions or expansions of open enrollment this year. They kept to the same schedule. And so that ends for us on December 7th. So there's always a lot of follow-up after open enrollment, and that'll continue. But December 7th is the Medicare open enrollment end date. As you know, we've had to make some pretty drastic adjustments to our staffing in the building with this most recent change. Moving to red level for our county, that changed our maximum capacity in the entire building, not just our floor, but our entire building to 4 people. And so we have had to thin down our staffing. And we've had a contingent of volunteers who went through some pretty in-depth training back in July and August to help support us on the phones. However, due to some of this thinning down due to the county orders, we're have to revisit that, because when we have a volunteer in, obviously we have to have a staff member in as well, and that limits our capacity. So we're working on that on a case-by-case basis. Some days we can have the whole building to ourselves, and so we can use the entire capacity for the AAA side, and sometimes we have to pass that along to other departments due to other functions. And so it's all really running on a day-to-day, week-by-week basis, but we have not, since March and the day that we had to officially go home to work, we have not stopped serving the public and our clients in any way. It just looks different. So really proud of our staff and our volunteers who were able, once we figured out some new technology, who came back on. And I think of our group today, I think B is one of our, I think the only one here today, but is one of our phone volunteers. So she sneaks in the back door and answers the phones for 4 hours and then sneaks back out. So it has actually worked really well, and we so appreciate that, you being a part of that team. So we're in the process of receiving some FEMA boxes, emergency 30-day shelf-stable food boxes, which will be distributed throughout our 3-county region. The State Unit on Aging, who, as you know, administers our Older Americans Act and Older Coloradans Act funds, went into a memorandum of agreement with FEMA to distribute these 30-day shelf-stable boxes. It has all happened very quickly. I was able to reach out to not just some of our traditional and contracted food-based providers, meal-based providers, but some of our other contracted providers, as well as some community partners. We very quickly, over the course of about a day and a half, 2 days of rapid emails and conversations about logistics, we're able to order some pallets of food. They're currently being put together in a Denver warehouse, and they will come to us. I do want to make sure that everyone is very clear. We will not do any distribution to the public from the AAA building. These have to go out to providers in order to reach the furthest corners of our region. And so I just wanted you to be aware that we are taking advantage of every opportunity to receive services, funding, and product to serve our clients and our older population across all 3 counties. This has given us the flexibility to not not have to work directly with or just with our contracted providers, but we will also be able to work with several community partners like Chris Larson and the Seniors Alliance of Platte Canyon, which will be nice. We'll be able to get that up to the Bailey area, working with Joyce and the Park County Senior Coalition. We can get that into the Fairplay area. We'll have pallets going to Cripple Creek, Woodland Park, who serves all the way out to Lake George. So the southern part of Park County will be served. We will have the furthest reaches. I'm looking for someone who can distribute in Rush, and we have pallets going. I'm also, Dave, and I sure would appreciate some on this, but we need someone to be able to distribute in the furthest northern part of the county. Perhaps B and Dave, we can put our heads together. And then we have pallets going out to Calhan to reach the furthest, and Rush to reach the furthest east parts of our county, of El Paso County. The beauty of this is that there's no cost to our AAA or PPACG, and there's no cost to the providers. They are making this agreement. FEMA purchased this food, and we are serving as the conduit to get this out. Yesterday, I asked if there was more room on the truck, and could we have some more? So we'll see. But right now, we're anticipating 15 pallets, and they're all spoken for, which is really great. So I'm really excited about that. It's just has nothing to do except with what we do, except for the fact that we are serving seniors. We're going to get these emergency food boxes into the hands of folks who in these outer areas could really be challenged because of weather and potentially COVID-related precautions. So just want to let you know that's coming down the pike, and we're working on that internally. You have, I've heard several times, and especially from
Jody, excuse me.
yes,
before
Mary.
Before you go on, those pallets going out to these outlying communities, are they specifically for the elderly or just for anyone who lives there?
Yes, no, these are specifically, there are three two primary qualifiers. Someone who is over 60 and someone who has COVID who can't go shopping on their own.
Thank you.
You're welcome. You're welcome. And like I said, those will be distributed by our partners. And so the beauty of this too is these can go to non-registered folks. Maybe they swing by the, Silver Key and say, I'm in a world of hurt and I'm over 60 years old and I can't afford to go grocery shopping. They have the freedom to give this to that person without registering them as a client. We'll get a monthly report from all of these providers and distributors as to how many we're giving out that is aside from getting these out to the providers and ensuring that they're following these mandates. That's really the only recording that we have to do is send that back up to the state on a monthly basis. So Jody, my expectations, it'll probably be one report. Everybody will distribute really fast. So.
I would bet.
Yeah.
Jody.
Yes, Dave.
Yeah. On the, so it's a pallet. What does it look like? I mean, is it a huge, literally a pallet of meals, or is it something smaller?
Yeah, so each pallet will hold about 40 boxes. Each box is 35 pounds, and each box has a 30-day shelf-stable meal selection for one person. For example, that'll be rice, canned beans, pasta, cereals, oatmeal, canned vegetables, canned fruit, canned sauces, canned chicken, canned tuna, oil, flour, that kind of thing. The idea is that I'm stuck, I can't go shopping, I have enough meals, I have enough product to create 30 days worth of meals.
Okay, can you send me an email with the details on that? What's in that package, and it'll help me talk with people up here, okay?
Sure, yeah. So what I would love to see is perhaps an opportunity where we could get these out through the Mennonite Senior Services, for example, there on 105. I think that would be a perfect opportunity, but also if there's food bank distribution in that area. So if we can get additional boxes or pallets on this truck, then we could distribute right away. I expect those in the next week or so. If not, and if they are available, depending on the requests from the other AAAs around the state, we may be able to order a second truck. So if we can't make it happen now, we can certainly be in discussion for potential future. So
as soon as I get that
so much, Jody, for
talk with
ramrodding that.
Lakes Cares. They're the ones here locally that really are heavily involved.
Right. Tri-Lakes Cares, right.
Perfect. Thank you. So yes, we'll be in touch after this meeting.
And if there's any extra cases available in our community center, we could distribute some as well through our offices if that's available.
Thank you. Yeah, Michelle, actually a pallet is scheduled for the senior center.
Okay.
And so I would encourage you to work with Lindsay and Mary to maybe coordinate.
I'll do that.
Yeah. Please feel free to do that. So.
And then just one other thing, super fast. I have some tickets for children of poor people. If there's any grandparents that are having custody of their grandkids, through one of the foundations that we work with, they're having a Christmas fund to give them presents. And so I have 10 tickets, so I'll say there's still 5 available in case anybody knows any people that have custody of their grandkids that they can have these presents.
I would highly recommend maybe getting in touch with Silver Key for their Grandparents Raising Grandchildren program. That may be an outlet for you.
Perfect. Thank you.
So the other area is the FTA 5310 funds that you have heard about transitioning from Mountain Metro Transit as part of the city over to PPACG for coordination with our AAA funding for transportation. And that's both traditional transportation as well as specialized transportation. That's typically also known as assisted transportation. That process is still in process. It's, as you know, it's a federal program. It's not for the faint of heart, and so we are very fortunate to have Laura Cruz on staff, whose primary focus is that now as she gets everyone moved over. Those are 3 providers who also contract with AAA, and so that's Silver Key, Invita, and Fountain Valley Senior Center, who have been working with MMT, contracted with MMT to receive that funding. They will now have access to fund. They'll go through a standard RFP process to access the 53, to apply for and access and contract for the RFP, or excuse me, the 5310 funding from the Federal Transit Administration that we will begin administering at the first of the year. So a lot more to come from that, but this is another one of those beautiful scenarios where we as an agency are now able to coordinate multiple funds and to better coordinate services into our community. So we're really looking for opportunities, not just to coordinate between the providers, but also to create efficiencies in the processes along the way, because we will be administering both the federal FTA funds as well as the federal and state AAA funding. So more to come with that, and so just wanted to make sure you had the opportunity to hear about that. As you also know, the Colorado Springs Commission on Aging, which was developed as part of the age-friendly process and became a part of the city council system of boards and commissions in 2017, has been formally dissolved under the city in November and is in process. We received approval at the end of November as part of our board action. We received approval to continue moving forward to transition that and stand that up within the PPACG system, and they will become a fellow commission under Area Agency on Aging. So their primary work will be in policy and advocacy, and so we're working on that. We've drawn up the bylaws. We'll be presenting the membership makeup, and at the next week's meeting on December 9th, and that'll go to the board for final approval. So, last item I have here is really just we're continuing to receive requests for access to the CARES Act emergency funding, but also requests for transfers within the accounts of our current contractors. As I've mentioned previously, our this emergency declaration has given us the opportunity to transfer monies between services that are currently under contract. As you might expect, I've given the example before. Back in the spring, one of the providers contracted with us for transportation, but due to the stay-at-home order, really, they had to park their buses and vans. They were not able to use those, but they continue to see an increase in their mental health requests and calls and counseling. And so under the emergency declaration, we were able to transfer their entire contracted funds amount balance from transportation to their counseling services, where they were able to continue meeting the needs in that new area, new to us under contract, not new to them. So it was a very smooth transition to enable them to have access to those funds to provide those services. So we continue to do that. I'm currently just going down the list of providers who have not reached out to us for either transfer requests or emergency funding, just to make sure that they're doing okay, that they know that they have a lot of flexibility in the use during this time. And we've had some interesting conversations, to try to help understand how these funds can be used. Those of you, and we have several providers here, the Older Americans Act is quite challenging, to say the least, to navigate as it relates to how the funds can normally be used, how we have to administer those. While there's still a lot of requirements in place, it's not a free-for-all. But this emergency declaration has enabled some flexibility in ways that have never been seen before, literally, since 1964 from the writing of the Older Americans Act. This is as unprecedented as it gets. And so that's why I'm having these individual conversations with providers to ensure that they understand the flexibility and the potential for these funds, or even just transferring among their within their current contract. And so we're making sure that these monies are able to be accessed and used and get those out in the way of services out to the community. So that's still in process. And I think that's all I have today, Madam Chair. I'm open to questions if anyone has any for me. I see that elbow, Mary.
Jody, could you tell me, please, who are you? What do you do? It sounds like you are on full-time staff somewhere.
I am so sorry, Mary. We probably should have introduced you to the rest of the staff.
Yeah, so actually, I'll do that. Let's see, Kent, Michelle, Imborski, Melody, Melissa, Jess, would you open your cameras for me? Okay, so to start with, my name is Jody Barker, and I'm the director of the Area Agency on Aging. And so those others that I've asked to turn on their cameras, Kent Matthews is the director of the Family Caregiver Support Center. Michelle Imborski, if you'll wave, is one of the coordinators within that same department. Jess Bechtel is our jack of all trades and master of every single one of them. She is our executive staff member support. She does it all.
Office admin.
Office admin. It's not enough. It's not enough of the title. I'm here to tell you guys. But Jess helps with a lot of the building structure, the planning meetings. She oversees putting together these packets along with our staff. And so you will, as a new member of the RAC, you will begin seeing emails and the Zoom invites from Jessica. So please be familiar with her. And then, and Jessica serves at the PPACG level, so our overall agency. So she works with all of our departments. And then Melissa Martz is our programs administrator and is another one of those jack of all trades. But if it has to do with seniors and making sure the needs are met in the community, she is a fantastic person to work with and get connections with, and is a great one to make things happen. So I am honored to be able to work with these staff members Melody is not on camera this morning, and but she is our, oh, there she is. There she just waved. Melody Dow is our programs and contracts administrator. And so she's new on staff with us, just came on at the end of October. And so she will be managing the contracts for the funds that we administer through the Old Americans Act and Older Coloradans Act. So welcome aboard, Mary. I'm sorry that we did not do that earlier, but
That's okay. That's okay. I'm used to trying to catch up. Do you by any chance have a line diagram like they do in the military that says who is everybody and how they fall into the line?
We do. Melissa can get that for you.
Thank you, Melissa.
Yeah, so, and Mary, you'll be receiving an actual packet, a RAC packet, and in that packet you'll have the org chart, but I may try to email that to you ahead of time.
Thank you.
So, you're welcome.
Melissa, maybe that could be sent as just a general to everyone, just as an update, if you would, not that I will be getting it, but.
Yeah, yes, you will.
Did Eric and Chris get their packets?
This
no, Eric.
did not. I don't know.
Oh no,
I'm talking about someone else.
Right.
Yeah, I thought we had a new member by name of Chris. That might be someone else.
You
But
did, Christopher.
anyway,
Yep, Chris.
Yeah, I may have got, I remember getting an email with some attached documents. I looked through a lot of them. I didn't look through all, but I had a question about the org and kind of the setup of the organization as well. So if that's in there, I can go back and take a look.
I did receive it as an email, Melissa, but I didn't receive it as an actual mail packet. So.
Yeah, so we are just for general, because I don't want to take from the rest of the meeting. But the Area Agency on Aging is the largest division of the Pikes Peak Area Council of Governments. The Council of Governments is a membership organization of 16 jurisdictions across El Paso, Teller, and Park counties, which also coincides with the AAA system. We are Region 4, so you'll hear that language on occasion. That's those same 3 counties. We also have our finance department. PPRTA is a division of PPACG, so you'll hear that occasionally in the news. So for those of you, we are we're down 1 staff member right now, but we typically stand at 16 staff members, and we're the largest of the entire agency. So any other questions about my report or anything going on?
Jody, I can't really speak well, but I'm not really sure to discuss this in open discussion or in detail, share it with everybody. But I have some real concerns about getting patients from a hospital post a COVID diagnosis or within the COVID cycle. They're released, their pulse ox is high enough, but they need to go home. We've had a couple of big issues with trying to get somebody home from a hospital. It's not like they can call their neighbor and say, hey, come and sit in the car with me. I'm clearly COVID positive. We can get you an ambulance, but it's going to cost you $1,500. If you're Medicaid, we might be able to find something for you. It may take a while, but Medicare, forget it. So it's a real big concern of ours. We know that Avita did get some funding through their Colorado Community Health Alliance, and that should help with transportation. We've recently had testing now set up at our local library, and Vita's been willing to drive people locally to that. But this COVID transportation issue is a serious problem. I mean, it took hours and days to even open a dialogue. I already have phone calls out to local hospitals to figure out what their systems are, but I would really like us to address this as an organization.
All right, thank you. Yes, I think that's something we could probably, several of us could put our heads together and see what resources might be out there. So thank you. I've made a note of that, and we'll
thank you, Jay.
do some follow-up on that, get you some referrals.
Thank you.
All right, if there's nothing else, Madam Chair, I'm going to hand it back to you.
Okay, well, thank you so much. Well, we're coming to the end of the year here, and so I think as chair, I simply want to say thank you to the many people that have helped me as I came in to this position mid-year. So I want to say a special thanks to Jody and Melissa and the staff of AAA for their support. Thank you to the executive committee that met to talk through issues and make sure we move forward smoothly. Thank you to our committee chairs who continued their hard work in running their committees. And thank you to obviously to our departing, I don't want to use that word. Thank you to those who are leaving the RAC, to Dave, who gave me a lot of mentoring as I moved into this position, and to Wendy and Lucy, who kept bringing in new people, because we were certainly knew that we were losing very strong members. And so before they left, they made sure that we had strong new members coming into the committee. So as I say, it's a time for thank yous. I also just have one little comment. You know, I've always been up here in northern part of the county. When I first moved here, it was hard to learn about the Area Agency on Aging and what they did and so forth. And so anytime I see something that tells about the work, I'm happy to see it. And so yesterday, I got my little Glen Eagle newsletter. Glen Eagle is the neighborhood in which I live. So this is just the tiniest little newsletter you might think of. And yet here's an entire article on no cost assistance for Medicare open enrollment. I was just thrilled to see that, and to see that the word is getting out, and others are learning of all the services that are available at the Area Agency on Aging. I think with that, I'm going to move on to our presentation of our officer slate for next year. And that's when
I guess I can say this is my last official act as the membership chair for our advisory council. And I am, it's interesting because for the last couple of days, my husband is kept asking me, so how are you doing? Are you doing okay? I'm like, I'm fine. Why? And he's like, well, I'm just, making sure, hope, don't want this to be hard on you. I'm like, why is it hard on me? You don't know, I've done 6 years, did a year off, and then came back for another 6 years. And during the last 6 years, I've never been able to find my name tags. But yesterday, I found 2 of them hiding. Of course, I find them both now. But one thing I would just like to just make a quick mention is that there are a lot of things I'm proud of that I've been a part of in this community. Now I know why he was asking me if I was okay. But as I look at this group of people and I see all those faces, there's nothing I am more proud of than the fact that you're all here because of me, because of my involvement and being involved in membership. Each and every one of you somehow was a part of that. And I cannot thank Lucy and Marilyn enough for always having been willing to be a part of that. And I have absolute and complete faith that Marilyn Bradish is going to do an excellent job. And so I would like to propose for the 2021, which is insane that we're even saying that phrase. So for the membership slate for 2021, we as a membership committee including B, who was very much a part of this as the chair as well. We are recommending that B. Babbitt continue as our chair for this following next year, and actually will begin her 2-year term. So even though she's been serving for a few months, this January will begin her 2-year term. Elaine Mackenzie has agreed to serve as our first vice chair. And then we have spoken with Bill Bowles, who has offered to serve as our second vice chair. And so that's who we're presenting. And I believe we do need a vote on this. And so all those in favor say yay.
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 Do we have any who against? Okay. Thank you very much.
Thank you, Wendy. And as my first official act, I'm going to appoint Marilyn Bradish officially as our new membership chair, with Wendy leaving that position. So
Thank you, B. Thank you. Some hard shoes to fill, but I'm going to work toward it and learn more each day and be motivated about it. Thank you. Thank you, Wendy and Lucy.
I am now going to, and thank you for the other officers who have agreed to serve. I'm now going to open it for any discussion items from our members.
I'd just like to say, yes, it's been a real treat and honor and a blessing to be able to participate in this. And a special thanks to Jody and to Melissa, also Kent, Jessica, Jen. The whole staff has done a tremendous job keeping us focused and supported and invigorated, if you will. So I think, and I sent a little chat note there, I believe that RAC is a very healthy and thriving organization. And it's largely because of the members, but also because of that incredible support from the AAA staff. So I just want to say thank you for that. I came across a quote just this morning, so this will be the last words I say. Not really, but you know, well. The quote is, leverage disturbance to unleash new life and new growth. And I thought that was in the context, really different context, but in the context of the pandemic, the end of the year and the rest of it, all of this disruption, this disturbance, it's an opportunity. Leverage disturbance to unleash new life and new growth. So thank you all. It's been a pleasure.
Thank you, Dave. Yes.
Yes, Dave, Wendy, Lucy, thank y'all so much. I'm astounded by what y'all have created and what y'all do all the time. And
Absolutely.
you will be missed.
Well, I can't believe it's been 6 years. I feel like when I started on this RAC committee, I was like 12 years old, and you know, now I'm almost 18. So I've grown up on this committee. But I've seen 3 different directors come and go, and all have been fabulous. But I just feel like so at home with Jody at the helm, and it's just been a great experience. I'm not going anywhere. I'm still going to come and be in the audience and listen in, because I don't know how to function without the meetings. So I'll still be around. And just because I'm not on the RAC in no way means that any kind of partnership is going away between the Blue Book and the AAA. It's my favorite organization in town. I've said it for years. It's a hidden gem, and I hope to some degree I've helped get it out there a little bit through the Blue Book and through our partnership. So I'm, like I said, I'm going nowhere. I'll still be around, but it's certainly been a pleasure. And I mean, honestly, just a great experience that I am going to miss being a part of. So, you know, I may surface back around and be a Wendy Farr and do another few more years down the road somewhere. So maybe I'll wait till I'm 60 in 40 years, but we'll see.
I would just like to comment though that I'm not the only one who did that. Joe Ruth did that too. She's done that long as well. I'm not the only crazy one.
Well, just keep in mind too that the RAC is with a C, not with a K.
What?
I got
Are there
Could
any
I say something, or Marilyn?
Yes.
I didn't want to interrupt if you were going to speak.
Oh, no, no, no. What I thought that I was off mute to say that taking on membership chairman role is something I look forward to, filling the shoes of Wendy, who is a person that, you know, I can't even adjectives, you know, find to describe her, you know, her commitment to our community in terms of the elderly and other philanthropic things she's involved with. It's amazing. It's been such a great time to work with and learn from her. And I have learned a lot and will learn a lot and move forward to find new members and make our membership diverse and, you know, working well. Lucy as well, it's been great knowing you and working with you on the committee. And again, I just look forward to serving in this capacity. I too feel like, of all things to want to volunteer for, the elderly are the demographic that I would really, really most love to serve. So I'm looking forward to my time ahead with you all. Thank you.
Any other comments?
As a newest member, I would like to say that what Lucy said was so true. An unknown gem in the area. I never heard of any of this before, but in July, I read a little tiny notice in the Fountain Valley News, and it said that El Paso County was looking for a representative to serve on this committee, and it had about 15 letters in front of it. And I thought, I am going out of my mind because I don't have anything to do and I'm not going anywhere and all my other meetings are canceled. So I sat down and filled out the application, and that was in July. And then I never heard another word about it until Wendy, bless her heart, called me early in November and said, we've got this application. Are you still interested? And by then I was very interested. And after today, I'm just amazed and in awe of what you all do. And I'm glad to be able to say what we all do. Thank you.
Great to have you with us, Mary, for sure.
Marilyn Massey, did you have something?
Mute.
You need to turn on your...
I was raising my hand as a amen to what Mary had just said about, and it's a great joy in being involved, Mary, because knowing what you've learned today and what we've all learned so much from brothers today.
Yeah, for sure.
That we can not only use that in our roles as members, but we can use it for all of the community, because it was knowledge that many of us didn't have particularly. So your questions today opened up another area of ways that we can serve. Thank you for asking the questions.
Marilyn, I really like your cat too.
Yeah, that long black.
He loves to get on around my neck when he's not getting any attention, and he likes hearing the voices.
That's a cat for you.
Well, I especially like the tail going across the screen a couple of times. It's like,
yes.
What
is that?
What was it the first time?
Yeah, he's a good companion.
That's good.
Well,
thanks, Wendy, who insisted on getting me a cat 6 years ago. And Wendy, and for Mary and those of you who may not know, Wendy is my daughter.
Oh, okay.
And she insisted that I needed a companion and to get a kitty, and I wouldn't pay for a cat. I am a generation where you picked up a cat out of a box outside the grocery store. And so she takes me down to the agency with 3 daughters, 5 grandchildren, and a great grandson to pick out grandma's cat. And this is the one we ended up with.
Great.
Funny.
Well, I wish we could have had our usual, for new members, we usually in our December meeting have a potluck and enjoy some festive time together. And unfortunately, we weren't able to do that this year. So hopefully next year we can have, a twice the celebration or something along those lines.
Look forward to it. Happy holidays. Merry Christmas.
Merry Christmas.
And to everybody.
To everyone, yes.
Our next meeting is January 28th, so that's the fourth Thursday at 10 a.m. And Jessica will send us our invite, and as was noted earlier, the agenda and minutes and so forth there will be a link to that. I must admit, sometimes that link doesn't take me to the document, but I can always go to the Pikes Peak website, Pikes Peak Area Council of Governments website, and find those documents. So they're posted there as well. We have our executive committee meeting will be on the first Tuesday in January. And other than that, if there's not anything else, we are ready to adjourn. Thank you so much for being here. Happy holidays. I look forward to
Bye-bye, B.
the future.
Bye, everyone. Merry
Bye
Christmas.
now.
Enjoy.
Bye-bye.
Bye,
Chris?
Wendy.
Bye-bye.
Let us know if
Bye,
you need
Lucy.
special prayers in your family with this COVID thing going on. We can all pray.
Thank you.
Yes.
Thank you. Thank you.
Chris,
Yes, ma'am.
give me a call, okay?
I will do so.
We'll talk. We'll make it short.
Okay. Bye,
Okay.
everybody.
Bye-bye.